In the last video, I was talking about how there's really no magic when it comes to rehab or performance. Everything in our body there's a reason that it's happening. And so our goal is to figure out why that is happening. And one of the things that I was mentioning was kind of the foundations of movement and the foundations of health. So where our movement breaks down, we can't necessarily just keep practicing that movement to help make it better. So I wanted to review just a little bit kind of what the goal of rehab is. So I put this little model together just to kind of help our thought process a little bit. So if you kind of think of it sort of as a hierarchy, at the top we're looking at performance. And so as that breaks down, we need to kind of look down into the foundation and see if there's anything to work on, because if the injury won't heal, our body's doing its very best to do that, but for some reason it just can't. And so continuing to practice the movement over and over is not necessarily the best strategy. Similarly, there's lots of videos sort of giving recipe-based programs for shoulder pain or knee pain, and it's really just throwing stuff against the wall unless we really know why the injury persists. And so this is just kind of a model to help you start thinking about what may or may not be going on there. So I don't want to talk too much about this, but at the very bottom, I kind of go from low resolution to high resolution, meaning high resolution is very nitty-gritty. It's the skill, it's the performance that you're after. It looks directly like what your goals would look like. Whereas we get lower in the kind of hierarchy, it's not directly related to the performance or the rehab healing, but it's necessary as a fundamental to create healing or to give a foundation for higher level performance. So in the bottom, I call that kind of foundations for health. I'm not going to touch on that too much, but it kind of gets into good water, good food, adequate sleep, just kind of those fundamental things that we need to be a healthy person. Above that, that's really the domain where I function in rehab setting. So I kind of say there's 3 pillars of movement as the fundamentals of movement. So what does that mean? I kind of call this mobility like the hardware. So if you need to squat, there's a whole chain of joints from our toes up to our head, and each of those joints needs a particular position to be most efficient for that movement. And so the mobility infers we have passive mobility in each of those joints for the specific movement that we need. Meaning, if I need to go into a deep squat, my hip needs a lot of hip flexion. We don't need hip extension necessarily for that movement. So it's very specific to what you would be doing is the mobility that you would need to work on. So we look in all the positions that you need, will the hardware sort of allow that position to happen? Second is the control. So just because someone has adequate movement, I could lay them on a table and move their hip into adequate hip flexion to do a squat, but when they stand up, their hip feels a bind when they get down in that deep flexion. So that would maybe mean that maybe it's not a mobility issue, but maybe it's a control problem. And kind of the way that I tend to think about that, I call that like the software. So where the mobility is the hardware, can the pieces achieve the position that they need to? The control means, can the software run the hardware? And that's kind of the coordination around the joint. Think of the core muscles versus the mover muscles. So just very generally, core muscles fire first. They don't create a lot of movement at the joint. Their job is to really stabilize in a dynamic way that joint so that there's a foundation for the big mover muscles to function on top of. If that coordination gets off, the joint gets pulled off axis and things just don't work right. So I call that sort of the hardware, the software, and then the last piece is the expression of that, the motor control. So to squat, we need, let's say, 120 degrees of hip flexion. We need the coordination around the joint so that our deep core for our lumbar spine and pelvis stabilize so that we can effectively use our hip. But then the expression is, do you have the strength and endurance to actually perform then a functional movement? So even though we need 120 degrees of hip flexion, can that now coordinate with the other joints at the hip and the knee and the low back and the upper back to do that movement? So this is kind of where rehab tends to sit. If your training is breaking down and just practicing the movement over and over again is not functioning, this is an area where you might consider looking back and shoring up some of those deficits at more fundamental level. Thanks for watching.